Hi, my name is Christine Tessmer, and I'm from Southwest Baptist University. My presentation is on probiotics and Cdiff. Why is this important? Cdiff can be very difficult to recover from, especially in older population. One of the articles talked about how they tried using probiotics, lactobacilli, and bifidobacterial on patients that were receiving antibiotics in the hospital. They chose patients 65 years and older to do their study on, which they are at higher risk for having more complications with this infection. The public needs to be aware of the symptoms of this infection due to the increased use of antibiotics in our society. My desire is to find a way that we can prevent C. diff and help patients with these symptoms of this infection, especially being a nurse and working in the hospital setting where I see multiple patients with C. diff. C. diff is an infection that has affected many patients in the hospital setting. C. diff is an infection that patients are at risk for getting due to antibiotic use. It is also considered a hospital-acquired infection if the patient gets during their stay in the hospital. Nosocomial infections, and especially CDAD, pose a significant risk to patients due to associated morbidity and mortality. This can be very costly to an organization, especially if they're getting Medicaid and Medicare reimbursements. This is important for patients to be aware of the symptoms and what causes C. diff and their possible option to help prevent C. diff while they're being treated in the hospital. For my PICO statement, this is what I've got. For patients 65 and older in the hospital, will the use of probiotics compared to just using antibiotics for treatment decrease the symptoms of patients that have C. diff over a 2-month period? Now that we have our PICO question formed, now we can start the research part of it. So Cochrane Library, which is located at www.cochrane.org, is a great tool to do research to find out what is available out there. So if you put in the keywords C. diff, and see what comes up. I had 5 articles that came up on the search. Then we can put in the more specific keywords and the Boolean operations and use C. diff and hospital patient and probiotics. Then you can also use the filters, which I used the infectious disease, the review, and then published 2017. This brought my results from 5 to 2 articles, which definitely didn't have a whole lot of results, only having 5, but it still is a way to cut down on how many articles that have. Other searches may bring up a lot more than just 5, sometimes in the thousands. Continuing on with our research, the National Guideline Clearinghouse is another great tool to use, and it's located at www.guideline.gov. So in this one we put in the keywords C. diff, and I only had 1 result for this search: Clostridium difficile infection in adults and children. This search usually will bring up more articles, and then you can use the filters again, applying those, putting in the year. In this case, I only had 1 result, so I was not able to apply any filters with this to minimize my search since there was only 1. So here are the results that I found. There were only 5 with the Cochrane and then 1 with the National Guideline Clearinghouse. These are the articles I chose that went best with my PICO question. I'm looking at probiotic use in Cdiff. So one of the studies was probiotic use has increased in hospitals from 2006 to 2012. They did not have necessarily Cdiff. It was just patients that were in the hospital getting treated with probiotics and sent home with probiotics because they were on antibiotic use. The next one, the article was on specifically using the probiotic lactobacillus and bifidobacterial to prevent antibiotic-associated diarrhea and Cdiff. So that one was a little bit better to look at, and this one also included the patient 65 and older, which is where my PICO question was patient 65 and older using probiotics to treat and prevent Cdiff. The next one was to see if probiotic VSL number 3 would prevent antibiotic-associated diarrhea and Cdiff. The next one was probiotics would prevent Cdiff in adults and children. That was a pretty generalized one. Antibiotic treatment for adults and children with Cdiff. This one did not have the use of probiotics. It was just testing what antibiotics were more effective in treating Cdiff for adults and children. So I had at least a couple good ones that I could use to try to answer my PICO question. Obviously, I didn't have as many results as I would have liked, so these were my options that I had, and this is why I chose them. So continuing on looking at the articles, similarities, 4 of the 5 articles talked about diarrhea, whether it was Cdiff or antibiotic-associated diarrhea. Also, probiotic use in the hospital setting is also mentioned in 4 of the articles. This was very helpful since that was my focus, was the probiotic use in preventing the diarrhea related to Cdiff. The inconsistencies that were found, one of the articles stated, we found no evidence that probiotic administration was effective in preventing antibiotic-associated diarrhea, although there was a trend towards reducing Cdiff diarrhea in the probiotics. And then the other article that used the specific probiotic, VSL number 3, is associated with a significant reduction in the incidence of antibiotic-associated diarrhea in average-risk hospital inpatients exposed to systemic antibiotics. So that one, they actually did see a reduction in diarrhea related to antibiotic use, which didn't all test out to be Cdiff, but that is definitely a good thing that they had some change in the positive direction of using probiotics. Differences, most of them were all specific with like Cdiff and probiotic use. There was one that specifically was using antibiotics to treat Cdiff instead of using the probiotics. So that was the only one that was different, that didn't really go along with my focus of the probiotic use in the hospital setting to help prevent the Cdiff. So there was some gaps and limitations in some of the articles and the studies that were completed. One was the study just needed to be tested in a larger scale to compare results. They had only had 229 total patients that they were able to use in their study. So that's just a very small amount to be significant enough to make guideline changes. The other one, there was no specific patient condition noted to why they were receiving the probiotics. No specific age group or gender. Additional research is needed to guide probiotic use in the hospital setting. This one was just the one where they just they're tracking the amount of probiotics that were being given to hospital patients but there was no link to why they were receiving the probiotics or why they were sent home with the probiotics other than the antibiotic use. And there was just no more research done on how that was effective. It was just on the increased use of probiotics. The other one was a better understanding of the pathogenesis of antibiotic-associated diarrhea and C. diff diarrhea, and the strain-specific effects of probiotics is needed before further clinical trials of specific microbial preparations are undertaken. So, just knowing which probiotics would be more effective, what pathogen is causing the diarrhea or the C. diff, to be able to test it further and see which one would be most effective on that. With most studies, there's always going to be, some gaps or some limitations that we will find. Overall, these, had good, significant information for us to use to continue on and further research in this area. So in conclusion, is there enough evidence to support a practice change? Did we find enough to actually back up this to help patients that are dealing with C. diff or preventing C. diff? The one where they were using the probiotics, there says has been an increased use of probiotics with very little evidence to back up the need. So that was just the one that they were giving probiotics to patients while they were on antibiotics or while they're in the hospital. So that one doesn't have enough evidence to really give us good information. As far as the guideline, I really didn't get much much information off of that because I only had one that came up with that. So there's not enough evidence to provide a guideline with the research on probiotics that has been conducted. The only guideline that was found was on the C. diff infections in adults and children, and that was mainly just going over the testing that you use to determine whether they have C. diff and the antibiotics that is recommended to use to help with C. diff. So this really didn't go along with the probiotic use that I was looking for to help prevent C. diff in the older population, 65 and older. So not having a guideline, was there enough evidence to support a practice change? It still needs to be tested a lot more. The rate of antibiotic-associated diarrhea was significantly lower in the active group per protocol analysts. The effectiveness of the VSL number 3 in preventing the antibiotic-associated diarrhea has been demonstrated clearly by significant per protocol analysts. As a large number of protocol breaches were due to poor adherence or complete refusal to take the study medication, it is probably not surprising that the reduction of the antibiotic-associated diarrhea. So, they had some breaches, but they still had the lower antibiotic-associated diarrhea that it did affect. So, as we have seen that there has been an increased use of probiotics, probably for this reason, because there has been some, I would say that we're going to continue to use probiotics in the hospital setting. The reduction in antibiotic-associated diarrhea incident was associated with a shorter hospital stay, but this fell just short of significant. So even though they did see some changes for the better and it did help improve and make the hospital stay shorter, there still isn't a lot of evidence. There still needs to be a lot more research done in a larger scale to see if the probiotics will prevent C. diff and help with some of the symptoms related to antibiotic use on our patients, especially those that are older than 65 that tend to have a lot of other issues going on with that, and they have a hard time with the antibiotics and the symptoms that come along with it. Well, thank you so much for listening in on my presentation. I hope you enjoyed it. Thank you so much.